Now the topic is alpha receptor. Under the alpha receptor, two types of receptor are there. Number one is alpha 1A, another one is alpha 2 receptor. Alpha 1 receptor and alpha 2 receptor. So where the alpha receptor will present, AL nothing but alpha, alpha receptor present on pH nothing but sphincter, what kind of sphincter? That is urinary sphincter. Present alpha receptor present on sphincter, urinary sphincter, and A nothing but artery nothing but blood vessel, artery nothing but blood vessel. Next one is R. See, alpha 1 receptor present on pH nothing but sphincter. Alpha receptor present on artery nothing but blood vessel. The same alpha receptor present on R nothing but radial muscle of eye. Okay, this R nothing but radial muscle of eye. So what are the actions? Of this receptor? See, alpha receptor present on the sphincter, urinary sphincter. See, here alpha receptor is there. Here alpha 1 receptor is there. This is the urinary sphincter, alpha receptor is there. Whenever there is a activation, initially it is open. Whenever there is a activation of alpha 1 receptor leads to the constriction. See, initially it is open like this. Whenever the activation of receptor means nothing but, see, here open state, here closed, the pore is closed here, urethra is closed like this, closing nothing but, see, for closing it needs energy, but in the tone, increase the tone. So what will happen when the pore is closed? Then whatever the urine is there in the bladder, see, initially whenever there is no close, the urine will come like this, urine will flow like this, urination will happen. Whenever the constriction, the urine will come like this, to the closure of bone will return back like this, the urine will return back like this. This is open state. Whenever the activation of alpha 1 receptor leads to the closure of the tone, closure of the sphincter will get closed. Closing of sphincter we can call as a increased tone. Urinary retention. Why the urinary retention means urine cannot pass through this pore because this pore is blocked or closed. That's why urinary retention. So where the urinary retention means when the urinary retention is happen, this is contraindicated in benign prostate hyperplasia. In benign prostate hyperplasia, alpha 1 agonist should be contraindicated. Why means this alpha 1 receptor, alpha 1 agonist upon the urinary sphincter, then the closure of sphincter, then the sphincter will get closed. Then urinary retention means urine will not pass through this. Urine get retained in the urinary bladder. In case of benign prostate hyperplasia, what will be there means urinary retention is the symptom. Benign prostate hyperplasia nothing but urinary retention is a symptom associated in benign prostate hyperplasia. This is already having urinary retention. Then upon activation of alpha 1 receptor, again the urinary retention will get. See, in prostate hyperplasia is there. Again urinary activation of alpha receptor leads to the urinary retention leads. That's why we should contraindicate alpha 1 agonist in benign prostate hyperplasia because already urinary retention retention is there. Urinary retention, again urinary retention leads to the damage to the kidney, That's why it should be contraindicated in benign prostate hyperplasia. Next one is artery. Alpha 1 receptor present in the artery. So what initially the artery will dilate in the dilated state. Whenever activation of alpha 1 receptor present on the blood vessel, then vasoconstriction. For the vasoconstriction, then we can use it in the treatment of hypotension. Hypotension nothing but low blood pressure. This is a blood vessel. The blood flow is like this. The blood flow is like slow. The blood flow is like this. Then pressure exerted on the wall. Then pressure exerted by this blood on the blood vessel, we can call it a blood pressure. So this will exert less pressure. In case of vasodilation, less pressure. When we will consider whenever the vasoconstriction is there, then the blood will flow like this. See, the blood will flow like this. Hence, more pressure is exerted. High pressure exerted when the vasoconstriction is. High pressure is exerted when the during the vasoconstriction. Low pressure during vasodilation. Low pressure during vasodilation. High pressure during vasoconstriction. So, upon activation of alpha 1 receptor leads to what vasoconstriction. See, this blood vessel get constricted, leads to the hypotension, post-urinary hypotension. Pressure is used. How the blood pressure is reduced? Due to vasodilation. So when you will constrict this blood vessel, leads to the vasoconstriction, then thereby pressure get increased. The pressure means pressure exerted by the blood on the walls of blood vessel get increased. Hence, vasoconstriction responsible for treatment of hypotension. When alpha 1 receptor get activated, vasoconstriction used for the treatment of post-urinary hypotension. And anaphylactic shock. See, in the anaphylactic shock, the symptom is there. What kind of it means? Same in anaphylactic shock, vasodilation is there, blood pressure is nothing but hypotension is there. So how can we treat the hypotension? Means by vasoconstricting, by constricting the blood vessel, increase the blood pressure. We can increase the blood pressure. First one completed, second one is completed, next one is third one. Alpha 1 receptors also present radial muscle of eye. Alpha 1 receptor also present in radial muscle of eye. See, this is the, for example, consider this is eye surrounded by the circular muscle. Okay, surrounded by the circular muscle and radial muscle. This muscle we can call as a radial muscle. Circular muscle, this muscle we can call as a circular muscle. So alpha 1 receptor majorly present on radial muscle. Alpha 1 receptor majorly present on radial muscle, but not on circular muscle. Circular nothing but circle we can call as a circular muscle. This vertical line we can call as a radial muscle. On radial muscle, alpha 1 receptor is there. Whenever the activation of radial muscle, then what will happen means this muscle contracted. This muscle get contracted. What will happen? See, there is a increased. See, mydriasis will happen. See, initially the hole is like this. Whenever this muscle will pull means mydriasis will happen. See, mydriasis. This is small. This is big. We can call it mydriasis. So what is the role of mydriasis? Means to examine. So through this big pore we can see what are the parts present, in our eye, and as well as retina. We can study the deeper portion of eye. By seeing this inside deeper portion of eye. We can study here. In mydriasis responsible for to examine the retina and deeper portion of eye we can study from that. Next one is alpha 2 receptor. alpha 2 receptor present majorly on brain stem. Alpha 2 receptor majorly present on brain stem. Then decreases the sympathetic outflow. Decreases the noradrenaline from sympathetic nervous system. Decreases the noradrenaline sympathetic nervous system. So the noradrenaline will decreases. Noradrenaline will act on heart. Okay. The work pressure means workload on heart get reduced. For the we can use for the treatment of hypertension. We can use for the treatment of hypertension. Alpha 2 receptor agonist we can use in the treatment of hypertension. Why we are using for the hypertension treatment means because there is a reduction of sympathetic outflow. There is a reduction of sympathetic outflow. Okay, majorly in the hypertension treatment we can use. This is about alpha agonist.